Time on Philosophy Talk, does science overreach?
Science is supposed to discover objective truths.
But some scientists claim a monopoly on the discovery of truth. Isn't that arrogant?
Championing science doesn't have to mean rejecting other forms of knowledge.
Well, tell that to scientists who dismiss things like religion and philosophy.
Does science overreach? Next time on Philosophy Talk.
Listen to Philosophy Talk today at noon on KSJE 90.9 FM, Farmington. KSJE is supported by San Juan Regional Medical Center, here to meet your urgent and emergent medical needs, whether they are COVID-19 related or not. Medical emergencies happen when you least expect them, whether it's a stroke, heart attack, illness, or injury. San Juan Regional Medical Center's caregivers are here to provide care to you and your loved ones. Find out more online at sanjuanregional.com. 12 minutes past 8 o'clock. It is Tuesday morning, April the 6th, 2021. Good morning, everybody. I'm Scott Michlin. Thanks for tuning in to KSJE 90.9 FM over the air here in San Juan County, 103.3 FM over the air in Durango, Colorado, and of course streaming everywhere from our website, KSJE.com. Welcome also to our viewers who are watching this visual radio program. The video is streaming live this morning to the KSJE Facebook page, our YouTube channel, and our Twitter account. So we're glad that you're with us, however you found your way here this morning. Coming up this morning, it is our monthly commitment to CHIC, the Community Health Improvement Council of San Juan County. And my guest this morning is Sue Hodgeman. She is the San Juan County Behavioral Health Director, and we'll talk more about that in just a moment here on KSJE. Later on this hour, I'll be talking with Amber Francisco from the Farmington Regional Animal Shelter at 8:50 a.m. We'll be showing you some of the pets available for adoption this week, including Mikey, who is on the screen right now. Then next hour, Mick Hess will take us roving with the arts. It's our classical music program. And this morning, Mick is playing some great symphonic music from Concertgebouw, that wonderful performing space in Europe. We'll talk more about that, of course, on Roving with the Arts next hour at 9:06 a.m. on KSJE. We invite you, too, to connect with us on other social media like Instagram, in addition to Twitter and YouTube and Facebook. And let's talk about our weather forecast, shall we? Outside right now, sunshine with a temperature of 53 degrees in Farmington at the moment. We're expecting a high today of only 60 degrees after a couple days near 80. It's going to get windy, though. There's a fire weather warning in effect until 8 p.m. tonight. We could see some wind gusts this afternoon, about 45 miles per hour. 60 for a high today, as I mentioned. Overnight, windy with a low of 32. Winds tomorrow continuing with a high of 66 on Wednesday, an overnight low of 35. Warming back up to 72 with sunshine on Thursday, 69 on Friday. Lower 70s for the weekend with lots of sunshine on Saturday and on Sunday. Let me introduce my guest who is here with me this morning. As I mentioned, Sue Hodgeman is here, and she is the director of the San Juan County Behavioral Health Services Department, I think. Did I get that mostly right?
That's good to me.
Okay.
I'll go for it.
Welcome. It's good to have you here. And you're here to talk about another kind of innovation with San Juan County. You and Lisa Gomez is working on kind of combining forces, if you will, right, to help residents of the county. And that's the reason that you come here this morning, right?
Let's pretend Lisa's right here with me. And because all the words coming out of my mouth right now are being coached by Lisa.
Gotcha.
So I'm actually talking about her program and what she's building.
Right.
And so...
but she's working with you. You're working with her, or you're working with her.
We're working
one or the
together.
other.
My department will be within her department. Her department will be the Health and Human Services Department with San Juan County.
Okay.
And so she and Mike Stark came up with this idea that it's time to put more value on the residents of San Juan County's physical health along with their mental health.
Right.
And for so long, physical health has been undervalued until something broke or something went bad and we had to go get it fixed. So they're looking at a preventative measure now to increase health options, to increase health opportunities within the county. And so they've created the Health and Human Services Department, Human Services bringing in behavioral health as well.
Which is your area of expertise as well. And we know, talking to you, when you were brought on in this new position as well, created by grant funding and things along that line to address behavioral health issues in our county. And so now these are joining forces, if you will, with physical health and becoming this new kind of Health and Human Services Department.
A whole big thing. You know, the wholeness of the body, the wholeness of everything.
Sure.
Because it all needs to go hand in hand. And when we bring physical health into behavioral health, it normalizes. And people will not be so afraid to get mental health services also if they understand it's just part of who you are and your well-being, and so we're keeping it all together.
Right. And we've heard a lot about this. Of course, this last year we've heard a lot about mental health and the need for mental health and behavioral health services, which is what you have been working on in San Juan County. And I think there's been a lot of folks that have reached out to get mental health services because of the pandemic, because of lockdowns, because of just how everyone's lives have kind of been disrupted in many, many ways.
Absolutely. A lot of people have called us, come in for connections to mental health services because being in lockdown or being in a different position, having, everything put on emergency or crisis, or everything we're going through is really pushing people to their brink. Everything has changed, and so people are trying to figure out a different way to deal, and we don't always have the skills. And so a lot of people have reached out to get connected to mental health services. There's been a lot of increase with substance abuse because that's been the national go-to. I'm stressed, I'm going to drink some more. And some people shouldn't.
Right.
And so it makes them less able to manage what they need to do.
Right. And I think all the unknowns, too, that have been gone along with this is that normally, at least we think, we're in fairly control of our destinies and lives, right? At least there's things we can control in our lives. But this last year, I think there's been a lot that we have not been able to control. And every day it was something new. And so I can understand where folks would...
Anxiety shot up, depression shot up. Unfortunately, suicide is on the increase.
Right.
Because people just don't know what to do. They lack the coping skills.
And it does not discriminate. It's old, young, rich, poor, it doesn't matter.
Across the spectrum, everybody. And
so again, and we want to plug the county's new mental wellness resource center, which opened over this past year.
It's located at 814 West Maple, across the street from San Juan Regional's Emergency Department.
Right there by the hospital.
Yes, very convenient.
So that has seen a lot of activity, I would say, since it opened.
Yes, we've opened up. We opened up in November quietly because of everything else that was going on. But we do have an increase in traffic. People walk in, they can call to make an appointment. They can email us on the internet, and we can help them make those connections that they need to have.
And that's been, I think, a really great resource, it's in the name, for residents, because people can, it's kind of a one-stop shop. They can call you and then be referred to these other entities in the community that offer these programs for them.
We don't refer, but we do create connections.
I see.
We can help them fill out the paperwork, the application process. We can help them just pick up the phone and make an appointment to wherever they choose to go to. We keep close contact with all the providers to make sure we understand what their hours are. Do they do telemed, telehealth, things like that? If they've changed locations, where are they at, so we can let our consumers know where they need to go. We help them make appointments, we help them get connected, and it's up to the consumer to decide where they want to go.
Well, they hold the power, I guess, in that decision.
Absolutely.
But you give them all the options, I guess.
We give them the information, the options.
Of what's available in the community. So again, kudos to San Juan County and you for putting this together, because this was one of your big projects, right? When you came on board to get the doors open.
I came on board to do this, yes.
Yeah. And so it's up and running, and so congrats. And now it leads us to the topic of our conversation this morning, working with Lisa Gomez about this new Health and Human Services Department to talk about not just behavioral and mental health, but also physical health.
Physical health, yes.
And of course, the county, and we know there's a lot of promotion about our outdoor recreation facilities and our trails and lakes and all these things that we can do to get out and be active. And it seems like that the focus is to maybe remind residents that we can use these things too, and we can get out there and walk around or take our bikes out and enjoy some of these things we're trying to get tourists to come and enjoy.
Right, absolutely. We have a lot of resources here. And so she's looking at collaborating with San Juan Regional Medical Center, with San Juan College, all the other entities in the area that focus on health, and create programs or create more programs or collaborate more closely with them in their ongoing programs, not reinvent the wheel, but more collaboration within the county of all these entities, and figure out what else do people need? What else do we need to bring to the citizens of San Juan County to help them increase their health and their well-being?
Sure.
We know that there's a high incidence of diabetes and a lot of other things, so we're looking at some things we can correct, some things we can't correct, but, diet and exercise, bringing in better options for food. We're looking at more farming options, more truck farms, more. I know San Juan College has got a great program starting up, too, so we really want to support them.
Right, the
and
food hub,
collaborate.
which
the
is
food
here,
hub.
but
Yes.
and working with other local farmers and regional farmers to create that network, if you will, of locally grown food.
Healthy, locally grown food that's easily accessible to all the residents of San Juan County. It's very important.
And that's a key, I think, all the residents of San Juan County, because we sometimes forget just how big our county is.
Very big.
And so when we talk about getting out and exercising and trails and things like that, some communities, quite frankly, have maybe better, more developed resources than others. When you take a look at the county view, there may be some gaps. And is that something that this department will be looking at too?
Lisa will be working on that as well, alleviating all the gaps, connecting all the dots to make sure everybody has equal access to all health care and all health resources.
Got you. And so we might see some county biking trails and hiking trails
Wouldn't that be
and
lovely?
things like
Yes.
that in the
Yes.
future. Obviously, if there's funding to pay for it, but
Got to find it, but yes, Lisa will find it.
I bet she will.
She will.
I bet she.
She's very determined.
I bet she will indeed.
Yes.
But this is a new focus from county government, right? And so,
Yes.
Is this something that's been coming around in other counties across New Mexico and other counties across the country?
That would be a really good question for Lisa. I don't know. I'm hoping
Right.
that more counties are woke and that they're understanding the strong connections that, if you want to have a healthy county, you've got to have healthy citizens. And I know Lisa recognizes that.
Sure.
And so I don't know where her inspiration came from. I don't know. I just know she's very driven and very focused on collaborating and creating some projects and making San Juan County the healthiest place to live.
Right. Well, she's gotten support from the county manager, you
Yes.
said, and so
Absolutely.
that's a good person to have on your side.
Mike Stark is 100% involved. Yes.
Right. And so, and we talked about this before we came on the air this morning, that this is a lot of these efforts are preventative in regards to costs and things like that. The county sees a lot of costs in health care for some of our citizens who are maybe ill or have these kind of progressive problems or things like that. And so being active earlier in life and staying active later in life can be a good thing to cut down on some of these healthcare costs that the county has to do. Right.
And, young childhood and on through the whole entire lifespan. We have to figure out how to be active, how to be healthy, how to eat right, how to have access to good quality food instead of junk.
Sure.
Yes.
And we see a lot of that, unfortunately, all over not just San Juan County. We don't have a
cheap
monopoly
worldwide.
on that. We have it all over the country
Yes.
and world. You're right. And so by doing this and having some of these programs available for everybody in the county, and again, being able to maybe look at areas in the county where this is lacking, maybe more either focus can be put on it, if there's more money to kind of put towards this to maybe help these other areas develop their own resources, trails, food systems, whatever. This is kind of what
That's
Lisa's
what
going to
she'll
be
work on.
doing.
Yes. Like we said, this program is brand new, or this department is brand new. It's still under development. Lisa works very closely with me, and so she's understanding what the Mental Wellness Resource Center and the Behavioral Health Services Department does as well. So she's learning her job, she's learning my job, and creating it along the way. And so it's a big project, but she can do it.
She can do it. That's true.
If anybody can, Lisa can.
And I want to make sure we explain to the audiences that this is a new county department, it's really pulling people from existing county departments.
Yes.
It's really nothing that's additional.
Right.
Does that make sense?
Yes.
It's
Yes.
kind of just using the resources the county already has in a different way.
Yes, Lisa's the manager of the H.C.A.C program, which is the healthcare, I can't think of what the other two letters are, but it helps with...
Assistance program.
Yes, that's it.
There you go.
And it helps people pay for medical bills and things. So she's worked with the state to make the program simpler, easier to access, less paperwork, less work all the way around. So now she's got the time to build another project.
Gotcha.
And so she'll be managing that, but she'll also be building this project too.
Understood. But she and you are already employees of San Juan County,
Oh, yes,
so it's not like
yes.
there's a
Lisa's-
hiring spree or anything like that.
She's right. No.
Yeah.
Everything is my entire program is grant funded, and Lisa's program, I'm not sure how it's funded. I can't speak for her, but she's been an employee of the county, I think, forever, since the county started.
She's
Sorry,
not that
Lisa.
old. She is not that old.
No,
but
she's
been there a very long time.
Very long time. Yes.
And certainly we've had conversations on this
Yes.
program about her work with when it was called the old Indigent Fund.
Yes.
And this new fund that you're talking about. And I think also part of this goes back to the Affordable Care Act. And so
Yeah.
there are many more county residents who are eligible for health care under this new federal Affordable Care Act. And so not as many are coming to the county and Lisa's program
Yeah.
for help there, which gives her time to work on this.
Yes, her department is streamlined now, so she's able to take on more and create a new department.
Right. Which is
A new
great.
focus, yes.
Exactly.
Which it goes in lockstep with the HCAP program, focusing on health. And when we go up front and do preventative activities and things, it's going to lower the cost of our health care ultimately.
Right.
So if we're healthier, we don't have to pay for all the health cost.
Exactly. And we've seen a lot of that over the years when talking about the other programs that Presbyterian Medical Services have been involved with and some of these to try to get help at the beginning of a
Right.
concern rather than treating folks on and on and on and maybe
Yes.
never breaking that cycle. And so I think this is kind of on the same lines,
It
although
is.
we don't always think about just not being physically active as a cycle, but it kind of is. You know, if you're just laying around the house and you don't do anything to break that,
It needs to be a way of life.
yeah,
Yes.
and to get it out there, and as you mentioned, forever
Yes.
from youth to senior citizens. So that's what we're talking about this morning. For your program, as you and Lisa work towards this, is there a time frame to maybe get some more things up and running? Is that more of a Lisa question?
Well, right now we're focusing pretty heavily on the Mental Wellness Resource Center and making sure all the needs of the county are met. You know, like you said, there's been an increase, a big increase in people seeking services. So she's helping me, you know, do that and solidify our program and make sure we're connected with everybody. And, you know, when you start a brand new program, you learn a lot along the way. And so
Right.
we're still learning a lot. And with Lisa's expertise, we're doing really well. But there's so much more to do. But the reason I really like the Lisa's program, the Health and Human Services program coming in with the Behavioral Health Department, is that it's going to normalize the need for mental health. You know, you go to the doctor because you don't feel good. You're going to go to your counselor because you're not thinking like you want to think. You know, you're having stumbling blocks in your reasoning, your thinking, your processing. You're depressed, you're anxious, you're just not feeling like you want to feel. So why can't it be normal?
Right.
It needs to be normalized. You know, we need to bring it to the level where everybody desires mental wellness and everybody's entitled to it, just like everybody's entitled to a well person checkup. Or if they're feeling low, they need to go see their doctor and figure out something's out of whack. We need to, you know, get you back lined up.
Right.
So it's normalizing all the care across the human spectrum.
Interesting, because we don't always think about,
No.
I think, that when we go for our annual checkups, and, that's our physical health.
Yeah.
But we don't think about having there isn't really an annual mental
No, there's not.
health checkup, and maybe there should be.
Very often we don't until everything falls apart around us. And then we have to pick up the pieces. We have to work even harder. So if we can do it on a regular basis and just check in with ourselves and go, oh, yeah, I can take care of that. Or, oh, I didn't know I was doing that. Yeah.
Right. Which is often hard for folks to realize about themselves, for sure.
Absolutely,
Maybe
yes.
a friend or family member could notice it easier than
They
you
do.
could.
They do, yeah. And we don't want to hear that. We just want to motor on, and because we don't want to go there. That's
Well,
too
there's
scary.
still a stigma, isn't there,
There is.
when we
There's
talk
a
about
stigma.
mental health, unfortunately, and it really shouldn't be that way, because
shouldn't be.
a lot of folks, I think folks would be surprised to learn how many folks reach out to get help when they need it.
The brain is just another organ of the body that sometimes needs help, needs support, like your kidney does, like your liver does, like your eyes do. We get regular eye checkups. Why don't we get regular brain checkups? I don't know.
Right.
We're afraid to go there, I'm afraid. I guess.
Sure,
I don't know.
but we shouldn't be.
No, we shouldn't.
And
We
that's what you're
shouldn't.
talking about.
Right.
And that this department in San Juan County may help to make that more acceptable for folks to understand that it's just like
It's just
going
like,
to your doctor.
yeah, twisting an ankle, you need to go to the doctor and get that taken care of.
Right.
You're thinking it's not really on task right now. Let's go check it out and see what's going on. What else is going on with you that's getting in your way?
Exactly.
Yeah.
And so by having these two together, the hope is to be able to then promote this more to county residents about making sure that they are healthy
Take
in
care
all the
of
ways they
yourself,
can be.
Take care of yourself, take care of your brain, take care of your body. Do what you need to live the very best life that you want.
Terrific. Well, it sounds like a great idea, and we're excited to see it happening here in San Juan County. It is, again, the new San Juan County Department of Health and Human Services.
Right.
You are working with that. Lisa Gomez is working with that.
Lisa Gomez is spearheading the whole thing.
And we will be hearing more about it, I'm
Yes.
sure, in the weeks to come. So we're excited about it. Great. Sue, thanks for coming in to share that with us.
Thank you. I appreciate being here.
Always great to
Good
visit
seeing
with you. You too. Thank you. That's Sue Hodgeman, my guest this morning from San Juan County here on KSJE. I'll be back with more in just a moment, everybody. The time right now is 8:31.
Excellent.
Google's Supreme Court win could actually benefit the little guy.